Dear students, welcome back. In the previous session, we have discussed about physiological basis for electrodiagnosis. Now, in this session, we are going to discuss about methods of electrodiagnosis. Out of these methods, the first one is the strength duration curves. It is also called as intensity duration curves. This simply we can call it as SD curve. What do you call SD curve? Okay. So the plotting of this strength duration curves, which indicate the strength of impulses of various durations, required to produce contraction in a muscle. And this is the most satisfactory method at present available for the routine testing of electrical reactions in peripheral nerve lesions. Okay. If you see the advantages and disadvantages of this SD curve, the advantages of this procedure of electrodiagnosis is that it is simple and reliable and indicates the proportion of denervation. A series of curves, if plotted, shows the changes in innervation as well as denervation. This is the advantage of this SD curve. If you see the disadvantages in this procedure, is in a large muscle, only a proportion of fibers may respond. Therefore, a full picture is not obtained for the whole muscle. It also does not tell about the site of lesion. Okay, that is the disadvantage. Okay, and if you see the curves which are obtaining in the SD curve has a characteristic shape which varies slightly depending on whether it is a constant current. So if you see the graph, on x-axis you'll have the duration, okay, y-axis you'll have the current, that is strength, intensity. So it is in milliamperes. Okay, so which is a constant current or a constant voltage stimulator is used for the purpose. Okay, so here you can find two types of graphs which are plotted by using different kinds of stimulator. So the first one, here we can find the intensity, that is strength, in the form of constant current, which is denoted in milliamperes, whereas in this picture, that is B, you can find it is present in volts on y-axis. Okay, this is the schematic representation of the graph. So actual graph obtained like this. Okay, yes, and if you compare with these two stimulators, so the graph which is formed is having some difference in shape, but this curve is normal, strength duration curve of normally innervated muscle, and this one is also normally innervated muscle, but this can be obtained by using constant voltage stimulator, and this is obtained from constant current stimulator. Okay, so the constant current stimulator, which provides the current flow in milliamperes, is thought to produce more accurate results, whereas the constant voltage type, which provides the voltage requirements in volts, is more comfortable for the patient. This is more comfortable for the patient, and this one constant current will give you accurate result. Okay, so that is the advantages of these two types of stimulators. Okay, now So the type of apparatus required for this one is the neuromuscular stimulator. You have to select, which provides a rectangular impulses of various durations such as 0.01 to 100 milliseconds. Okay, more than that also we can use minimum 100 milliseconds, maximum 100 milliseconds should be present, and minimum 0.01 millisecond are used, which may be constant current or constant voltage type. So both the cases the duration must be present in this way only. Okay, and if you see the method, as usual for all the methods, the same type of method we are going to use here. You have to position the patient and prepare the skin for stimulation. That means you have to reduce the skin resistance, and you have to place the electrodes. Okay, and the patient must be sit in full supported and in good light. And if you see the electrodes, we have to use indifferent electrode, which may be applied to some convenient area, usually on the midline of the body or over the origin of the muscle group, and the active electrode over the fleshy part of the muscle. Okay, alternatively, two small electrodes may be used, one over each end of the muscle belly. In either case, the active electrode should be fairly small in order that the muscles may be isolated from each other. Okay, here the current which is applied using the strong stimulus first. So first stimulus you have to given, that is the longest stimulus, that is 100 milliseconds. We can start it from 100 milliseconds or 30. We can start it from 100 or 30. Okay, and then increased until the minimum observable contraction is obtained. Okay, this may be assessed visually or by palpation of the tendon depending on the muscle being tested. The magnitude of current is noted and the impulse is shortened. This procedure is repeated for each length of stimulus in turn, the magnitude of current being increased as required. The utmost precision is essential if the results are to be accurate. The minimum observable contraction is used as this makes it easy to detect any change in strength, and it is important that the active electrode is held on the same point over the muscle throughout the test. You can't change the point. Okay, the strength duration curve is plotted from the results of the test, and although it will be further to the left with the constant voltage than with the constant current stimulator. So if you see here in the voltage, the graph will move towards the left side. Okay, so and here also it will move left, but on voltage it will move more left than that of the constant current stimulator. Okay, so this is about the strength duration curve, what kind of apparatus you have to choose and what is the method you have to use. Next, I will see the characteristic features of strength duration curve. One is the normal innervation. Okay, so these here in this we are seeing the graphs of normal innervation. So when all the nerve fibers supplying the muscle are intact, the curve obtained has a characteristic shape which is seen in these pics. The curve is of this typical shape because the same strength of stimulus is required to produce a response with all the impulses of longer duration, while those with shorter duration require an increase in the strength of the stimulus each time the duration is reduced. Okay, the point of rise of the curve with a constant current stimulator is around 1 millisecond, whereas that with the constant voltage is at 0.1 millisecond. If you see in the complete denervation, when all the nerve fibers supplying a muscle have degenerated. Okay. So the strength duration curve produced is characteristic of complete denervation. The curve is obtained like this. For all impulses, okay, how many impulses? For all the impulses with a duration of 100 milliseconds or less, the strength of stimulus must be increased each time. So each time it is increased. Okay, increased each time the duration is reduced, and no response is obtained to impulses of very short durations. For very short durations there is no response. There is no response here. Okay, so that the curve rises steeply. So this is the curve rises steeply and is further to the right itself. So it is present only at the right. There is no shift towards the left side. Okay, right, than that of normally innervated muscle. In normally innervated muscle, the graph is like this, isn't it? So, but here a completely denervated muscle, this one is steeply raised and mainly present on the right side itself. So here you can see the duration also. It is at the 100, 30, 10. So there is no response which is coming when it is reduced. The time period is reduced. There is no response. And also if you increase this current intensity also, there is no stimulus we are getting here. Okay, yes. Next. So this is the type of curve which we can see in the complete denervation. And now we will see what happens in the partial denervation. So in the case of partial denervation, when some of the nerve fibers supplying a muscle have degenerated while others are intact, the characteristics obtained clearly indicates partial denervation. Here you can find partial denervation. Okay, the impulses of longer duration stimulate both innervated as well as denervated muscle. So a contraction is obtained with a stimulus of low intensity. Okay, as the impulses are shortened, the denervated fibers respond less readily, so that a stronger stimulus is required to produce a perceptible contraction, and the curve rises steeply like that of denervated muscle. So with the impulses of shorter duration, with the shorter duration shows the kind of curve which we have seen in innervated muscles, and the impulses with longer duration shows the type of curve for denervated fibers. Okay, both the fibers we can find in the graph. Okay, so here the point of the separation. So here in this curve we can find a kink. What you call a kink we can find here. Okay, in the case of partial denervation. Okay, so that is the point where these two sections are meeting. That means the innervated as well as the denervated fibers are meeting. The appearance of a kink or discontinuity in the curve is a reliable early sign of denervation and in the progressive involvement of nerve lesions. It provides slightly later evidence of denervation than electromyography. Okay. Yes. This is about the type of nerves we can see in the partial denervation. Okay. So here you can find the picture in B. This is the B picture. So here the strength duration curve of partially denervated muscle showing different degrees of innervation. So if the majority of the fibers are innervated, the curve is lower and flatter. So the curve is like that. If majority of the fibers are innervated, the curve is lower and flatter and bears a closer relation to that of full innervation. Okay. So this is all about the partial innervation. These are the different types of strength duration curves which are obtained in different condition. In the next session we are going to discuss about another method called as nerve conduction test. Thank you.